Hi, my name is Diane Elms, and I am not a medical doctor. I'm a homeopath, regulated under the Regulated Health Professional Act. And I believe it's time for a change in our healthcare system, and that's what the Phoenix Rising Center is all about. So let me read our mission statement. So the Phoenix Rising Center is a non-profit organization providing a holistic approach to health and wellness by regulated healthcare professionals that specialize, or the center specializes, in drugless cancer care. The center is for all people, no matter what their financial situation is. The Phoenix Rising Center will be operated mainly by donations from like-minded people and companies who believe it's time for a change in their approach to total health and wellness in our community and beyond. So the Phoenix Rising Center was built out of, the idea of the Phoenix Rising Center was built out of the idea of helping people really go to the root cause of what their health situation is. And one of the main reasons is to deal with cancer. So the center will deal with all health issues for people, but focusing a lot to do with people for drugless cancer care. I believe it's time for a change in our healthcare system. And in the last little while, in the last 3 weeks actually, I have actually come across what is called the Cancer Act and the Cancer Remedy Act. So in Ontario, we are actually under a law that states if I'm going to use me as an example, if I came up with a remedy that actually could prevent or cure cancer, in Ontario, we have a law that's been in place since 1938 and 1943 that states the commissioners, which are appointed by our government, can come and take that remedy from me, and they can destroy it or sell it or do whatever they deem necessary for it. Now, we live in Ontario, Canada. It is 2017 when I'm making this video. There needs to be a change in our healthcare system when we have a law in place that actually says government can come and take something from me if I come up with a remedy that can prevent or cure cancer. There's something wrong with that. That's why I believe the Phoenix Rising Center needs to be built. It already is functioning, but needs to grow to a bigger facility so that all people can have an option and a choice towards a different approach to healthcare system, especially towards drugless cancer care or towards their care in cancer. One of the reasons, or one of the ways that I think we should be looking at a different approach to drugless cancer care is using homeopathic medicine. Now, I'm a homeopath, so obviously I believe in homeopathic medicine. But why I believe in it is because it works on the total person. It works on the mental emotional state of a person, and it works on the physicals of a person. And that's what I believe makes the difference in being able to help a person restore their health. Now, millions of people, I realize some people have never heard of homeopathic medicine. I realize that. But millions of people actually use homeopathic medicine. Does it really make sense that millions of people would use homeopathic medicine and have used it for over 100 years and it not work? No. Millions of people use homeopathic medicine because it works for them. And in fact, I actually went on rounds in a hospital in Lucca, Tuscany in 2015 and that did a 12-year study and implemented homeopathic medicine into their publicly funded healthcare system. So this is some of the things that they found out. They did a 12-year qualitative study that showed 20% of the patients had their complaint was completely resolved. 27% significantly improved, 22% good improvement. And what also it did was that they had an overall cost effectiveness of reducing pharmaceutical use by 63.57%. They reduced their pharmaceutical use by 63.57%. Do you understand how much money that would be, that could be put back into our healthcare system towards other ways? Now, I believe that we need to have the choice of using whether we want to use homeopathic medicine. We are in a publicly funded healthcare system in Ontario specifically. So, not only did the study show that it reduced the use of pharmaceuticals, but it also showed that there was little to no side effects from using the homeopathic medicine. This has already been a study done. In Ontario, we can implement this into our healthcare system because homeopaths are already regulated. You know, a lot of times people don't understand that there's not one answer to how a person can get well. We're all individuals. And so sometimes you have to make an individual approach to each and every person to what their needs are. So that's why I believe the constitutional remedy, homeopathic medicine, works so well and is so effective for people in their healthcare. Again, it's all about choice. If somebody still wants to do traditional things from allopathic doctors, that's great. But the Phoenix Rising Center is about having a choice and using complementary medicine. As a regulated healthcare practitioner, I cannot put patient testimonies on the website. So you listening to me might be thinking, well, let me hear it from your patient. I'm not allowed to do that. So it's pretty difficult to sometimes get the information out to how effective complementary health care can be in people's lives. So again, I believe that people need to have a choice. I believe it's time that we look at our healthcare system in a different manner. I believe it's time that we pay taxes and our healthcare system is funded by our taxes, that we should have a voice to be able to utilize the funds that we're paying for into our healthcare system to in a healthcare system that more and more people are searching out and doing complementary health. So I believe that that should be incorporated into our healthcare system. But in the meantime, until that can happen, the Phoenix Rising Center is a center where people can come for complementary health, for all health needs, but specifically focusing on drugless cancer care. You know, the choice is really yours. You need to take control of your health. We're here to help you, and thank you for listening to this.